Cancer is currently the leading cause of overall cancer deaths, but according to a new study by the Pancreatic Cancer Action Network, pancreatic cancer could surpass both lung and liver cancer as the most deadly by 2030. Filling in for our Arise medical contributor, Dr. Aletha Maybank, that we're used to seeing, here is Dr. Cheruba Prabakar. She is a OBGYN at Maimonides Medical Center, and if you're a regular watcher of Arise America, and we certainly hope you are, then you just saw her a few days ago talking about the very important subject of fibroids. So welcome back to Arise America. It's good to see you. How you doing?
You too. Good.
I'm good.
How are you?
Yeah, I'm doing great. But let's talk about, this is a very serious topic, pancreatic cancer.
Yes.
Not all that common, but man, when it happens, it's deadly.
Absolutely.
Talk about why there is such a high mortality rate with pancreatic cancer.
Right. So when we talk about cancer deaths, the top three have always been lung, prostate for men, breast for women, and colon. And pancreatic cancer has been hovering around as the fourth. And the recent study has just shown in 15 years it's going to bump up all the way up to number 2. The triad that's frequently associated with pancreatic cancer is obesity, as well as there are some genetic risk factors, poor physical activity, smoking, and several other risk factors. But there's not one thing that we can pinpoint to pancreatic cancer. But this is big news because although the incidence of pancreatic cancer is only 2.5% worldwide, it is almost uniformly fatal.
Yeah, it really is astonishing, these statistics in that way. Now, you said that it's going to rise in the number from 4 to 2.
To 2.
And is that because of the risk factors? Because more people are obese, more people...
Exactly. I think people are moving less, people are eating more fast food. You know, we know that the American population as well as around the world, we're becoming more obese. And so these are definitely risk factors. Pancreas
is not an organ that we talk about a whole lot, and a lot of people don't really know that they have one or what it does. So what does the pancreas do?
The pancreas is an organ in the abdomen that is responsible for synthesizing a lot of chemicals that are key in digestion. And the one thing that we talk about a lot when it comes to pancreas is the formation of insulin. And insulin is responsible for keeping our blood sugar levels in control. So those with poorly functioning cells in the pancreas often suffer from diabetes.
Let me ask you about the treatment. What is surgery always the treatment of choice with chemo afterwards?
Yeah, pancreatic cancer, unfortunately, by the time we detect it, is often in its advanced stages. So surgery is an option either to cure it or just in terms of palliation, and then followed by chemo and sometimes radiation.
Why is it so hard to catch?
Because the symptoms are fairly vague.
And when I say catch, I mean detect not catch like an infection.
Right, so some of the symptoms are nausea, vomiting, weight loss, heartburn, abdominal pain, and as you can imagine, a lot of diseases have similar symptoms. And by the time it becomes severe enough to go see a doctor and get imaging, it's often too late.
All right, let's turn the page and talk about another health issue, and that's whooping cough.
Yes.
Of course, it seems like it's a disease of many decades ago, but it's making a resurgence, particularly here in the New York City area. Our viewers here will recognize, because we have commercials, PSAs, running all the time. What does whooping cough, and why is it reemerging?
Right, so whooping cough is a highly contagious disease. It's caused by a bacteria, and it waxes and wanes in terms of its incidence around the world. Every 3 to 5 years, we'll see an outbreak. Recently, there's been one in California. Right before that, we saw one in Colorado. And for adults, you know, the reason it's such a big deal is for adults, you know, we present with coughing and fits of coughing, during which we have to take breaks to breathe. And when you breathe, that's when you make that whoop sound. But it's a much bigger deal for children and infants who can sometimes die from this because their immune systems are just too, you know, too weak.
I'm going to rush you along just a little bit on this, but the important thing with this is vaccination.
Absolutely. All pregnant women should get vaccinated. If you miss it when you're pregnant, get vaccinated right after you deliver. And that's the best way to prevent the spread of pertussis.
Let's try to talk about our last topic with the time that we have left, and that is very surprising finding: high cholesterol can affect fertility.
Right. So there have been a lot of risk factors for fertility: age, obesity, poor, you know, in terms of sperm quality and semen quality. But this is definitely a new study that's shown that when both partners have high cholesterol levels, it can take a longer time for them to conceive. And even if one partner has high cholesterol levels, it takes a longer time to conceive than if neither did. So what does this mean in terms of young women women trying to conceive, it really means that we need to optimize our health before conception. So weight loss, good diet, exercise, and really trying to keep those cholesterol levels low.
I mean, is this research strong enough to say that high cholesterol can be, if you will, causative in this issue, or complicates?
Right, I think complicates and plays a role. We can't exactly say causative just yet. But in terms of Americans, 71 million Americans are treated for cholesterol, and 1 in 3 children have high cholesterol. So this is a big deal that we need to think about.
Yeah, it's important just to get our cholesterol, at least the bad cholesterol, down anyway,
Yes,
no matter
yes.
what.
Yeah.
Dr. Cheruba Prabakar, thank you so much.
You're welcome. My pleasure.
And you're watching Arise America.